We have also asked for surveillance to be stepped up at the ports, whereby we will meet the various flights coming in from Haiti, and those flights will be met. Persons will be questioned appropriately according to some guidelines we'll be using, but still you cannot stop them from going into the community. The most we can do is to give them guidelines and advice and what to look out for, and to actively follow up with them.
Checking airline passengers returning from Haiti is only one effort the Ministry of Health is taking to ensure that cholera does not reach the Turks and Caicos. The ministry is sending out a notice to schools, to TCI water and food companies, asking all to be aware of the disease, how it can be spread, and the symptoms to look for.
Cholera is caused by a bacteria, so it's not a viral infection, it's a bacterial infection. And persons will contract it through either ingesting contaminated food or water, and also coming into contact with any fluids, be it whether or not you ingest it or gets into your mucous membranes, your eyes, etc., can also get infected that way as well. And it usually surrounds unhygienic conditions. You recognize that we are at risk simply because we have a high traffic between Haiti and Turks and Caicos, and we do have communities in Turks and Caicos that are vulnerable, persons who may live in certain conditions that are unhygienic, and so you increase the risk of it spreading throughout the community, that other persons can get it.
Symptoms of cholera are easy to treat if caught early, but if not treated, it can be fatal.
Well, the symptoms can be anything ranging from diarrhea and vomiting, but the majority of cases are actually can be asymptomatic or very mild symptoms of diarrhea and vomiting. Then the majority, those ones that are most dramatic are the ones that have severe diarrhea, explosive diarrhea with rapid dehydration. And those are the ones that tend to die if they don't get treatment.
Officials are urging the public to practice good hygiene when using the restroom, especially those that work in the food or water industry here in the TCI. Brian Hogan from NHIP stated that medication is ready and available if cholera reaches the Turks and Caicos.
The National Health Insurance Board is staying in very close contact with the Ministry of Health as the recommended antibiotics emerge. Then we'll take the steps to make sure that they're on the NHIP formulary, that we put the word out to our drug distribution, the private pharmacies, to make sure that they are maintaining adequate supplies and have the ability to bring in additional supplies in a very short period of time.
With the high amount of traffic between the Turks and Caicos Islands and Haiti, health officials feel that though there are no reported cases of the disease to date, the risk for cholera reaching the TCI is high, and awareness and early prevention, according to them, is essential to keeping the disease at bay.
But our main objective is to try to prevent it from coming here, because even a single case, if it comes here, can still spell problems for us.
News 4 will keep you updated on this situation.